Folic acid is a synthetic form of folate, which is a B vitamin found in some foods. It is essential for forming healthy cells, especially red blood cells. Folic acid supplements are available in different forms and are used to treat or prevent low folate levels, which can lead to certain types of anemia. Low folate levels can be caused by factors such as poor diet, pregnancy, alcoholism, liver disease, certain stomach or intestinal problems, kidney dialysis, and others. Women of childbearing age should ensure they have enough folic acid in their diet or through supplements to prevent spinal cord birth defects in infants. The daily recommended dosage for folic acid is 400 micrograms for most adults, and the best time to take it is in the morning with food. When taking folic acid, it's important to follow the dosage instructions given by your doctor. Typically, it is taken once daily, with or without food. If you are using an over-the-counter product, make sure to follow the directions on the package. The dosage will depend on your medical condition and how you respond to the treatment. It's crucial not to increase the dose or take it more frequently than prescribed. To receive the maximum benefit, it's important to take folic acid regularly. Try to take it at the same time each day to help you remember. It's also recommended to follow a diet plan provided by your doctor or a dietitian. If your condition persists or worsens, or if you suspect a serious medical problem, seek medical help immediately. If you experience any unusual effects from taking folic acid, it's important to tell your doctor or pharmacist right away. However, folic acid usually has very few side effects, and many people using this product do not have serious side effects. A very serious allergic reaction to folic acid is rare, but if you notice any symptoms such as rash, itching/swelling, dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects. If you notice any other effects, it's best to contact your doctor or pharmacist for advice. As for the optimal timing and daily dosage of folic acid, it's best to follow your doctor's instructions. They will have determined the appropriate dosage for you based on your specific needs. Taking folic acid at the same time each day can help you remember to take it consistently. Before taking folic acid, it's important to let your doctor or pharmacist know if you have any allergies or if you are allergic to this product. This is because it may contain inactive ingredients that could cause allergic reactions or other issues. It's also important to discuss your medical history, especially if you have a vitamin B12 deficiency, pernicious anemia, before using folic acid. If you are planning to have surgery, it's crucial to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Folic acid is safe to take during pregnancy when used as directed and is included in prenatal vitamin products. Taking adequate amounts of folic acid during pregnancy may help prevent certain spinal cord birth defects. It's essential to consult your doctor for more details. While folic acid does pass into breast milk, it's unlikely to harm a nursing infant. However, it's still important to consult your doctor before breastfeeding. When taking folic acid, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. If someone takes too much folic acid and experiences severe symptoms like passing out or difficulty breathing, they should call 911 immediately. Alternatively, they can contact a poison control center. In the US, residents can call 1-800-222-1222, and in Canada, they can call a provincial poison control center. Symptoms of overdose may include mental or mood changes. It's important not to share folic acid with others, as it is prescribed based on individual needs. Your doctor may also recommend lab tests to monitor your folate and vitamin B12 levels while taking folic acid, so be sure to keep all medical and lab appointments. Folate can be found naturally in foods like leafy green vegetables, organ meats, and citrus fruits, while folic acid is added to enriched grain products. If you're looking to increase your folate intake through your diet, consult your doctor or a dietitian for a plan rich in folate and folic acid. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take your next dose at the regular time. Do not take a double dose to make up for the missed one. When it comes to storing folic acid, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of folic acid, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, it's best to properly discard the product and it is expired or no longer needed. For more guidance on how to do this, it's best to consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.